shown here. 4,14,188 cases have been reported in the last 24 hours alone. This is the highest number of cases that have been reported in the country in a single day so far. While India has also registered 3,915 COVID-related deaths in the last 24 hours. To get an update on the COVID situation in the country, we have Sonakshi joining us. Sonakshi, over 4 lakh cases for the second consecutive day, with the highest number of cases being recorded in the last 24 hours alone.
Well, that is absolutely correct. The country is reporting a spike in its daily COVID cases. We did see a dip in the number of cases between the 2nd May and the 5th May, which was between 3 lakh, below 4 lakh actually, between 3.5 lakh to below 4 lakh. But now, for the last 2 consecutive days, the country has been reporting over 4 lakh COVID cases daily. The number that we are at today is at 4,14,188. The number. This is the highest number of cases. The deaths that the country has reported in the last 24 hours stands at 3,915. Remember, the country is getting vaccinated. People, there was a lot of vaccine hesitancy if we recall up to last year. But now people are booking slots. They are trying to get vaccinated. There is an enthusiasm. But despite all of this, despite certain restrictions and curbs in several states across the country, in order to break the chain of this transmission, the country still continues to report a spike in its daily COVID cases. Remember, the vaccination process is also going across the country pretty smoothly as so far we've reported, but that doesn't change.
Was one of the countries to first propose a suspension on vaccine patents, and it's now also the country most in need of help in fighting the pandemic. On Thursday, it reported more than 400,000 new COVID-19 cases and almost 4,000 deaths, setting records for both. The burden on the country's hospitals is becoming increasingly unsustainable. It's all hands on deck, with even medical students now being called in to lend a hand.
Running low on sleep, junior doctor Rohan Agarwal dresses in protective gear to begin a 27-hour-long shift. He's only 26 years old and hasn't even finished his medical training.
What job we are assigned is what is to be decided by God. Yeah. Whom to be saved, whom not to be saved, and we are not made for that. We are just humans. Yeah. And at this point of time, we are being told to do this. So it's really a depressing atmosphere, and I just want a break.
There is a severe shortage of oxygen and ventilators at this hospital and others across Delhi. Many people come looking for a bed for a sick relative, but these are also in very short supply. Patients and relatives crowd every available space. In some cases, people lie close enough for patients to touch. One man is in a storage room, surrounded by bins of medical waste. Rohan says the sounds of his workplace haunt his sleep.
That beep sound is
another grim milestone inside a nation in crisis. Like oxygen, hospital beds are in short supply. This secretly filmed video shows COVID patients being treated alongside people with other illnesses. Outside this under-equipped hospital, Pankaj is mourning the loss of his wife, Rekha.
इंजेक्शन लगाते थे, रेमडेसिविर जो दवाई आती है इसकी, वो नहीं मिली. वो मिला होता तो शायद कि हो जाता ठीक.
She was just 35. Despite the surge, the national government continues to resist calls for a total lockdown, so states are going it alone. In Andhra Pradesh, local guidelines on public gatherings were ignored as a crowd clamoured outside a vaccination centre.
The only way to get this under control is if we lock down completely. Otherwise, people will never learn.
In neighbouring Karnataka, it was a contrast in complicity. With shuttered shops and bare streets, many are complying with a statewide lockdown. But this national patchwork of lockdowns and restrictions is too late for many. Sonia can't find a bed for her infected brother.
We tried to find a hospital bed for 3 days but failed. What shall we do?
There are countless examples of the scramble for oxygen turning deadly.
The courts have intervened, demanding the centre government provide the amount that hospitals across the country so desperately need. Delhi finally got what it wanted yesterday after raising the alarm for weeks.
The oxygen we've got from the suppliers so far doesn't meet our demand at all.
While India's vaccination drive sputters, there are warnings the outbreak has a long way to go.
We should make sure that there is a concerted global action to contain the pandemic as fast as possible so that the variants will not have an opportunity to spread easily or for fresh variants to arise.